Live now, we can start, Namrata.
So, good evening, everyone, and I welcome you all to today's session. My name is Namrata Patkiri, and I shall be your host for today's session. So, here I am with another webinar session on community health with Enajori. So, moving further, I would like to brief you all a bit about what Enajori is. So, Enajori, in simple words, as its name suggests, it means the bond of love. Milind Datta is the founder of Enajuri, and it is his love for his native land that brought him back from USA to Assam to start this non-profitable organization that engages and promotes various initiatives such as striving for social change, loving leadership qualities, and building entrepreneurship capabilities among the people living in Northeast India. So over the past few months, we have been in contact with speakers from various regions via virtual media, and we have tried to discuss with them the very current and significant topics of today's generation. So moving forward, we have today's guest, Dr. Garima Kumar. She is a versatile healthcare professional from All India Institute of Medical Sciences, Jodhpur. She is currently serving at the Ministry of Women and Child Development. Her passion for public health helps her formulate preventive strategies for improving healthcare systems and promoting community well-being. She has also received prestigious recognition from the Department of Global Health at the University of Washington and has been awarded as a scholarship for her participation in the Policy Development and Advocacy for Global Health course. So today's session will be on the topic breaking the silence, discussing HIV and its impact. So we welcome you, ma'am, to today's session. And now I would like you to take over the screen. Please, ma'am.
Good evening, everyone.
Good
Am
evening,
I
ma'am.
audible?
Ma'am?
Am I?
Yes, yes, ma'am, you're audible.
Oh, okay. Okay. I would like to give me your permission so that I can share the screen. I'm able right now.
Ma'am, your
Please.
voice is breaking a bit. Ma'am, could you
Yes.
repeat?
Am I audible now?
Yes, ma'am.
I'm unable to share the screen now. Give me the access right now.
Ma'am, you are already the co-host, so you should be able to. Can you please check?
Yeah, that's good. All right, I get that. I got that. My screen is visible to everyone?
Yes, ma'am, it's visible.
All right, all right. Okay. Today's topic we'll be discussing about the bring the skills, discussing HIV and its impact. For this session, I would like to ask, what do you think? What is HIV? What is your knowledge? Can you
Yes,
give me a brief what exactly you know?
ma'am? Yes, ma'am?
Any brief idea you already have for HIV?
Yes, ma'am. Ma'am, as I have studied about HIV in my school days, so as we all know, HIV stands for Human Immunodeficiency Virus. So, ma'am, as its name suggests, it attacks directly to our immune system and we feel weaker. And, ma'am, there are various ways through which this virus can be transmitted from one person to the other, like having unprotected sex. Then, also, if we come in contact with the blood which is infected with this virus, then we can also get affected through this means. Then there are also some other ways, like having drugs is also a reason, sharing the needles and injections. These are the various ways through which this virus gets transmitted. This is the whole idea I have about HIV, ma'am.
Right. That's very great. That's very great. I'll tell you first that what is HIV. We commonly use interchange one HIV and AIDS. And we use it very often that we don't know what is exactly HIV and what is AIDS. So firstly, I would like to tell that the difference between HIV and AIDS. All right. So HIV, as you said very rightly, that it stands for human immunodeficiency virus. The name itself says that it is attacking our immune system. As it is attacking immune system, so it's in our body weaker, and so many infections we can caught by that. But I talk about AIDS, it stands for acquired immunodeficiency syndrome. See, this is a very later stage, very advanced stage when one person acquired HIV. Okay? It is not that HIV person is said to be that he is having a AIDS. A person can acquire AIDS at very later stages of the life, and it may also not acquire, he or she may not acquire if they take the proper treatment. And this has to be, I have seen many people saying that AIDS hai patient ko, AIDS hai. It's not like that. It takes so many years to develop that later stage. Okay, so I would say first that I said that acquired immunodeficiency syndrome. The word itself says that we are acquiring the deficiencies there of our immune system, and the word they are saying syndrome, not the disease. And what is the difference between a disease and syndrome is, syndrome is like when we have so many other symptoms, when we have a very group of diseases all together. As you rightly mentioned, कि हमारा immune system weak हो जाता है, our immune system gets weaker, so we are prominent, we are virulent, we become very vulnerable to so many other infections, right? So हम बहुत सारे infections catch कर लेते हैं who the person who is living with HIV. तो एक डिजीज नहीं होगा उसको, उसको टीबी भी हो सकता है, उसको मेनिंजाइटिस भी हो सकता है, उसको सार्कोमास, कार्सिनोमास, कैंसर्स भी हो सकते हैं. So many different symptoms happen, so many disease occurs. That is why it says as to be the syndrome. That is why the name came as to be the syndrome. So you have to remember that AIDS is a chronic. Chronic is like long term. It takes so many years to acquire, potentially a life-threatening disease, which is caused by the virus HIV. It is not the HIV. It's not the thing. They are very separate, different things. HIV and the AIDS. Coming to the next part, I'll say how it is being affecting our immune system. You said that it attacks our white blood cells. White blood cells of our body are the immune system. They are the army of our body, right? If our army gets weaker, so we are very virulent, very susceptible to so many infections. I said it, right? We very easily get sick, and we can acquire diseases like TBs and the lymphomas. As you said, how the HIV is transmitted. HIV, remember, very basic thing, blood contamination. Blood could be, can be by anything, right? सबसे पहला ब्लड का कंटामिनेशन हम देखें तो आता है हमारे पास ब्लड ट्रांसफ्यूजन, फिर हमारे पास आता है ऑर्गन ट्रांसफ्यूजन, right? But I'll tell you, blood transfusion and organ transfusion are now at a very lesser risk for HIV transmission, क्योंकि healthcare sector has become very robust. So अभी perform each transfusion of before organ transfusion. Say HIV का transmission is little lesser than the other risk. दूसरा ऐसे हमारा blood हो सकता है shingles. There are drug users who use one sentence range. So that causes, that is a very high risk of thing that they can transmit HIV. That also, second is pregnancy, childbirth, and the breastfeeding. There is a thing where is pregnancy, it water, but if the lady is very suppressed, so there are less than 1% chances. Any problem?
Yes, ma'am. Yeah, your voice is breaking actually.
Okay, wait, let me check. Am I audible right now?
Yes, ma'am.
As we discussed, that use of shared needles, right?
Yes,
Second, there
ma'am.
is a pregnancy, childbirth, and breastfeeding. I would say there is a misconception that if a lady is HIV negative, there are very high chances that she will transmit HIV to the baby, but not if she is taking proper treatment. If she is having a very suppressed viral load, there are less than 1% chances that HIV will be transmitted to the child. Right? Also, we don't know. See, as we say, there is a chance of transmission from blood and from injected needles, shared needles. There is also a chance that a mother uh, milk can also transmit HIV to the child. But again, the same point, if the mother is taking proper ART treatment, if her viral load is suppressed, then also it's very less chances that HIV will be transmitted from the milk to the child. So it's a safer option if she's taking a proper care of her. Also, if we are saying the childbirth, there are usually two type of child deliveries. We talk about the vaginal deliveries and cesarean sections. So if the viral load of any lady is high, is detectable, then we prescribe them to go for a cesarean section rather than a vaginal section, because vaginal delivery may lead to HIV transmission to the child. Right? And unprotected sex. Further, unprotected sex is you can say सबसे ज़्यादा HIV transmission is occurring because of this rest of बाकी options के comparison में. So we have to practice a safe sex practice using condoms while doing that. Organ transmission, blood transmission I have mentioned. There are so many misconceptions that HIV can be transmitted by saliva, can be transmitted by sharing the food, can be transmitted by sweat, tears. So no, this is a very big myth in our society that it can be transmitted. It cannot be transmitted by this. Kissing is a safe, kissing से transmit HIV नहीं होता है, saliva से HIV transmit नहीं होता है, only if the person, for example, I am a person who is living with HIV, I can practice a kissing practice until unless it will not transmit HIV to the other person. Agar I don't have any oral symptoms, if I have any oral ulcers, any bleeding gums, any blood contamination in mouth, then there are chances that HIV can be transmitted. Otherwise, saliva cannot transmit HIV from one person to the other person. Sharing toilet seats is no, HIV won't be transmitted by that, not by mosquitoes, not by sharing dishes, not by saliva, not by tears, not by sweat, not by shaking hands. So these all are the stigma in our country, in the society, that these are transmitted. No, it's not. Coming to the signs and symptoms, I'll tell you. In the first slide only, I said that AIDS is the advanced stage of the disease. It is the later stage of the disease. HIV के symptoms are very vague in the beginning. Okay, उसको दिखने में बहुत time लगता है. First few months बहुत कम symptoms हम देखेंगे. Later stages the symptoms may progress. Alright, in the first few months we'll be having fever, headache, rash, sore throat. These are very vague symptoms. One will not be able to identify कि उसको it is a viral disease or any bacterial disease, or it is because of the HIV infection. So it's a very vague symptoms first initially, and later on, as the disease keep on progressing, what are the symptoms? There are some swollen lymph nodes, weight loss, fever, diarrhea, cough. I'll tell you, 90% of the people living with the HIV have a common symptom of diarrhea. They have a weight loss, continuous weight loss despite of having a good diet. Swollen lymph nodes. Swollen lymph nodes are like they can feel a swelling in their armpits, behind their ears. That's how. And later on, if they are not taking a proper treatment, as I earlier mentioned, they may acquire other diseases like TB, cancers, other several bacterial infections. So these are how the symptoms may progress. But the question arises here कि how the person will get to know कि उसको HIV के symptoms है कि किसी और के symptoms है. I would like to tell, we know कि we are being exposed to the HIV thing or not. If you have practiced any unsafe sexual practices, then yes, the symptoms may be because of the HIV infection. If anyhow you are involved in sharing the needles, so yes, you may be a victim of this. So we know in which practice we are involved, and you after that practice, if you face such symptoms, that it's mandatory that you should consult your doctors for the same. And if I say what are the symptoms at the advanced stages of this AIDS, prolonged fevers despite of taking medications, prolonged fevers, night sweat is a very identical symptom in AIDS that people will get to know. Swollen lymph nodes, chills, and the weakness and the unintended weight loss. They will lose weight rigorously. As I said, what will be the risk factors that you may acquire HIV? As I said, if the person is practicing a condomless anal or a vaginal sex, so they are at a greater risk of contracting the HIV. Again, the sharing the contaminated needles, syringes. As I said, blood transfusion and the organ transfusion. If you are taking it a blood transfusion and an organ transfusion in a proper protocol, in a good healthy settings, least chances that you'll acquire HIV. But if you are getting from any quack, if you are taking in a black or in a force, but if you are getting blood transfusion or organ transfusion in a wrong way, na, so वहाँ पर test नहीं हो रहे हैं, so you may acquire. So it's better that you go in a proper protocol in a hospital setting and then take these decisions. As we come to the treatment, there is no treatment, no cure for the HIV. We say that HIV is a non-curable disease, but it is a preventable disease. We can prevent it at each stages, right? So we cannot cure it. There is an antiretroviral therapy is there for HIV. What it is, what it does, the antiretroviral drugs, they stop the virus from replicating in the body. As they are keep on replicating themselves in the body, so they target that, they will not allow that to replicate. Along with that, they make our immune system more stronger so that we can fight with the rest of infections and not acquire the other infections. The main focus of ART is like we have to suppress the viral load. हमें virus का load कम करना है. As I mentioned earlier also, if the viral load is undetectable, we are taking good ART therapy. We will live, the person who is living with HIV will live a better life, will live a good life as an us life. Same. So main target is if a person has acquired HIV infection, so it's mandatory that they should properly follow the regime of ART and they will live the normal life as rest of the population. Right? So ART is very must in the case of the HIV, people living with the HIV. It reduces the risk of this transmission of virus. As I mentioned, that it reduces the amount of HIV in the body, reduces the risk of transmission. It prevents HIV from advancing to AIDS. As I said, AIDS is the later stage. So if we are taking from the very beginning, this year also on World AIDS Day, there is a theme that take the test and take the step. If we take the test at the earlier stages, now we are preventing ourselves from developing AIDS. क्योंकि हम जितना पहले टेस्ट लेंगे उतना पहले we start with the ART therapy and we will stop ourselves, we will prevent ourselves in advancing to the AIDS. That much how the ART therapy is relevant in this AIDS, HIV, sorry. It protects our immune system, it prolongs the life expectancy to the near normal. That is how it is effective these days. So the question arises, how we can prevent it? So we say ki, if you are practicing a safe practice, safe sexual practice is the one practice that you can prevent yourself from the HIV transmission. And if I say there are two types of other things, there are pre-exposure prophylaxis and a post-exposure prophylaxis. Prophylaxis is a word used in medical for prevention only. Exposure se pehle and exposure se baad. I'll talk first about post-exposure prophylaxis. If you have a unprotected sex practice with anybody, you don't know the status of the other person, he or she is HIV positive or not, then the post-exposure prophylaxis is for you. Consult your doctor, tell your status, then they will provide you with a post-exposure prophylaxis. But the mandate is that you have to take this within 72 hours of your encounter. For example, any rape victim, we don't know कि सामने वाले का what is the status of the other person, if he or she was a HIV positive, then the post-exposure prophylaxis within the 72 hours of the encounter. Coming to the pre-exposure prophylaxis, pre-exposure prophylaxis हम कब करते हैं? when we know the person is HIV negative, we know he is or she is a confirmed HIV negative, then only we'll give pre-exposure. For example, I am a HIV negative person and I have a husband who is HIV positive and I want to conceive. I have a fear. Will my child will develop HIV? Will I will develop HIV? Is I am safe with him or not? So pre-exposure prophylaxis is for me. I am a HIV negative person. I can practice. I can conceive also by taking pre-exposure prophylaxis. Along with that, it's not mandatory that if you're taking pre-exposure prophylaxis, so you can practice unprotected sex practice. No, along with that, you have to practice both things. You have to use condom while practicing sex. Also, you have to go with the pre-exposure prophylaxis. So this is the concept of pre-exposure prophylaxis. Coming to the stigma, there is so many stigma which is associated with HIV in our country, in our society. Firstly, what is stigma? We'll say stigma is like we have made our beliefs for HIV. हमने उसको categorize कर दिया है कि HIV people मतलब this group को होगा ही होगा. We have made our negative attitude, negative beliefs for the same. हमने मान लिया है कि इस ग्रुप में HIV होगा, ठीक है, LGBTQ कम्युनिटी में होगा, सेक्स वर्कर्स हैं तो उनको HIV होगा ही होगा. This is our belief. We have made this stigma in our mind. We have stigmatized this thought in our own society. And also, stigma की वजह से how we behave with them is the discrimination. Because हमारे दिमाग में बैठ चुका है, so now we behave accordingly and then we discriminate them. We don't have a closure with them. We refuse any casual contact with them. We don't talk. We don't sit with them. वो डिस्क्रिमिनेशन आ जाता है जब हम उस चीज को एक स्टिग्मा बना के अपने माइंड में चलते हैं, है ना. हम रेफर करते हैं कि ये तो एड्स पेशेंट है, इसको तो HIV है. First of all, I'll tell you there is a statement, we don't say HIV positive patient, we never say HIV patient. Now the terminology has been changed. We say people living with HIV, PLHIV, all right? Because they are living with it. They are the warriors, they are living, है ना, वो फतेह कर रहे हैं HIV के साथ. They are living like us. So there are people living with HIV. That is word. We have to change some terminology also, right? So this was the external stigma we talked about कि हमारी society ने क्या किया. So this external stigma ना, they have created an internalized stigma in the people living with HIV. उनको अपने अंदर से एक stigma आ चुका है. They have felt it कि the society will not accept me because society thinks us like this. वो internalized stigma is way more dangerous than like any other. हम HIV person मान लेता है कि if I'll share, they'll discriminate, they'll not let me allow to be in the society. They have this feeling of shame, of fear, isolation, right? So they don't go. ये सबसे बड़ा problem इसलिए because they'll not share. For example, I am the person who acquire HIV. I have a fear that my society will not accept, my partner will not accept me, divorce me, that's it, and I'll not share it. But at the end, what I am doing, I am transmitting the HIV to the further person. And this vicious cycle will keep on going. So we have to work on internalized stigma as well. We have to tell them that you are just like us. You have to share. There is no fear. You could share this. It's just like a normal other disease. We have to work on that, right? So ये सारे स्टिग्मा पे करने के लिए what we can do, we have to talk about this. This is what I think कि अगर हम इस बारे में बात ही नहीं करेंगे ना, so we can't solve this issue. We have to talk about it. We don't talk about HIV. We don't about safe sex practices. We don't talk about condom also, right? ये words बोलना इतना stigmatized हो चुका है society में, and we have to talk about this. इस बारे में हम लोगों को हर लेवल पर बात करनी चाहिए. At the vulnerable population, at the younger generation, everybody should talk about this. This is not HIV is not a rocket science. कोई बहुत बड़ा नहीं है. It's a preventable disease. हम इसको रोक सकते हैं as much as we can, but we have to talk about, we have to generate awareness about it. हमें awareness generate करनी है. There are so many misconceptions कि saliva से हो रहा है, breastfeeding से होगा, ऐसे होगा. So उस बारे में हमें raise करना है awareness. That is how we have to work for it. We have to give the HIV education. लोगों को पता ही नहीं है. They have a misconceptions, so many misconceptions, myths. So we have to educate them, right? We have to encourage the dialogues, right? Like हम क्या करते हैं कि हम जज करते हैं HIV को. हम we don't have to do that, right? chose supportive language. As I said, we have to say people living with HIV rather than saying AIDS patient, HIV positive patient. We have to say people living with HIV patient. हमें अपने terminologies थोड़ा change करने चाहिए. We have to be supportive with them, right? They're already dealing with so many infections and their own traumas in their mind. We have to be a little supportive to them. Support group should be there who can be talked about for those who are living with HIV, who can counsel them. As I said, we are giving ART therapy in the treatment. I'll tell you, government has a very robust system for HIV. There are so many ART centers in each and every city. When you go to any hospital and you're diagnosed with HIV, you are being referred to the ART centers specified. They have all the staffs, they have the counselors, they have the each and every staff, each type of doctors you will find out there. The counselors give them counseling. They help them with their internalized stigma. They tell them to share their stories, to come up in the front, to help the other persons also. ART center में counselors इतना counseling करते हैं कि if you are living your life a better way, come to our center. Newly diagnosed को you will help them, you will counsel them that it's not a very huge thing, you can live with it. So that is how the ART centers are working in our country right now. तो वो काउंसलिंग बहुत रिक्वायर्ड होती है बिकॉज एक स्टिग्मा उनके माइंड में चल रहा होता है. सो दिस इज हाउ द थिंग्स आर वर्किंग. I hope there are many questions you must be thinking you want to ask. So go ahead. I'll share answers, whatever I can help you.
Ma'am, you just said that HIV is something which is non-curable but preventive.
Yes.
So, what are the medical advances in this, in the prevention of this virus?
Prevention of the virus, I said ना, antiretroviral therapy is a you can say एक बहुत अच्छी advancement है. ये मैं बोल रही हूँ ना, if on a pregnant lady, it cannot be transmitted to the child. Less than 1% chances if the lady is taking a ART treatment. ये ART therapy अपने आप में बहुत अच्छी therapy है in a treatment and prevention. ये बहुत later stages में अभी जब से आई है, we have seen the statistics have said कि this is a very proven therapy जिससे हम transmission को बहुत हद तक रोक सकते हैं. मतलब आप ये देखो ना, हम बोल रहे हैं कि see the delivery is via vaginal section or a cesarean section, there is a placenta involved, blood, mother share the blood with the child for the 9 months, right? And still the ART therapy will allow that virus does not enter into the child. This is itself a good thing which I have seen in the medical advancement. तो ART थेरेपी अपने आप में बहुत अच्छी थेरेपी है जो काफी हद तक रोक रही है इसको ट्रांसमिशन से.
Ma'am, then yesterday I was like searching a few websites which about HIV, and then there was something common in all the websites. It said that HIV, when a person, it's like a person should go for regular checkups in order to check that whether they are infected with this virus or not. So that regular term was like repeatedly there in the websites. Like yesterday only, until yesterday, I was not aware that we have to go for the regular checkups. So ma'am, yesterday I became cautious. I became a little more cautious about this thing. So ma'am, is it true that it's all about regular checkup, or when a person gets symptoms of this, then only he has to go for a checkup?
See,
Or a
I
normal
have said
person for that.
I have said this term in the risk factors slides also, signs and symptoms slides also, कि आपको signs and symptoms का wait नहीं करना है develop होने के लिए. You already know if you are involved in any such practice, right? I must be knowing if I am practicing any unsafe sex practice. मुझे पता है. If I am involved in this, I don't know the status of my counterpart, if he or she is HIV positive or not. So there should be a fear. और आपने एक unsafe practice करी, then you should go for a test, right? If you are being encountered with any needle stick injury at any hospital, कुछ needle stick हुआ, then you should take a precaution. You should go for a test. And if you are involved in sharing the needles, then you should go for a test. That is how you have to go for a test. It's not like that कि आपको you must be knowing कि आप उस चीज में involved हैं या नहीं है. Also, a regular test is not required. that way is not required. मतलब if you are involved in such practices, then only you should go for it. जैसे blood transfusion की मैं बात करूं और मैं organ transfusion की बात करूं, तो organ transfusion से पहले there are a huge list of tests of a patient. उसमें सब टेस्ट इसीलिए होते हैं because of organ को check. There is not only the blood group is checking, we are also checking, we are ruling out all the viruses from the patients and from the recipient and the donor. दोनों का हम लोग ये check करते हैं. तो उस स्टेजेस पे हमें एक रेगुलर टेस्ट मतलब एक शेड्यूल टेस्ट रन करना होता है, अदरवाइज इट्स नॉट रिक्वायर्ड. इफ यू आर इन्वॉल्वड इन सच प्रैक्टिसेस, देन ओनली यू शुड गो विद द टेस्ट.
And then, as you say that the most common reason for the transmission of this virus is unprotected sex. In many countries also, this is the only major reason through which this thing is transmitted. So, what do you think? What is the importance of comprehensive sex education in preventing the spread of this virus?
See, sex education I feel is very mandatory. Sex education usually starts when at the age of puberty, right? Puberty we usually hit at the age of 13 years, and आजकल 10 to 12 years we are the younger generation is hitting their puberty at 10 to 12, and at that time हमें sex education is required. And I'll tell you why. If I don't know about my biology, if I don't know my physiology, how will I prevent the disease occurrence? How will I be knowing? I'll tell you one thing here that we usually say that sex workers, we always have this thing also, the LGBT community also have a very high, they are vulnerable for this HIV. There is a term, gay, we use it also in other countries, we say men having sex with men, right? So they are very vulnerable for HIV transmission, and there is a reason. There are two kind of practices: the vaginal sex and the anal sex. Anal sex has 10 times more risk of acquiring of giving a transmission of HIV rather than the vaginal sex because of the biology of the rectal tissue. And if I will not be teaching this at their to them, they'll not be knowing what precautions they have to take, right? So sex education is very mandatory कि हमें उन्हें right time पे बताना है how our body is working, how the physiology of body, and at which step they have to take the prevention of ताकि वो disease को वहीं पे समझ सके. Younger generations at this age are involved in so many practices. If they doesn't know about physiology, they'll not know what precautions do they have to take. So I think sex education is very much required to understand the biology and understand at which stage they have to take the prevention, very particularly.
So, ma'am, as you already mentioned about this vulnerable communities like LGBT or the sex workers. So, ma'am, as you also say that it is a kind of shame or fear when we have to confront about this virus to someone. So, ma'am, we already know that these sex workers and the people belonging to the LGBTQ community are already the suppressed and vulnerable ones. So, ma'am, what do you think that what are the kind of challenges they face in regular basis if they are infected with this virus?
See, the community are already discriminating them, right? LGBT community को हमने बहुत later stages में we are like अभी we have given the acceptance in our community, और अभी भी they have not got that acceptance what they deserve, I guess, you know. And same we have, why we have discriminated sex workers, because of the two reasons only, right? So they are already facing the discrimination on this regard. So they are facing day by day, these are the challenges they are facing. I can say discrimination उनके साथ हमेशा हो रहा है, but the point is we as a community health workers, I think we should make them more little aware about this, because there are so many sex workers, I believe they don't know about it. They know about HIV, they know about it, कि हाँ एक HIV होता है, they know about condoms also, but they are not aware of how it is happening, what is this disease, how severity of the disease is, and what practice will help them. So मुझे ऐसा लगता है कि community health workers, we should give them awareness about this. उनको वो awareness अभी भी बहुत ज्यादा जरूरत है. We are not working on it, I guess. उनको ये aware करना is very important कि how this is working, because अभी भी they are still involved and they are still suffering with this. बहुत सारों को information नहीं है, awareness हम नहीं कर रहे हैं, तो उनको aware करना सबसे ज्यादा जरूरी है, so that they can prevent themselves from such diseases. They are already being involved in such practices, but it's our duty as a community, it's our duty as a health workers that we should make them aware and teach them what practices are required, why it is required. We teach them this is required, the condom is required. We never teach them why it is required, how it is happening. I think grassroots level अगर हम उन्हें समझाएंगे, then it's be a little more easier for them to face such things.
And then the thing is that in the classrooms also, we never bring out these situations or these topics, because of which many of the children remain ignorant. And then when they grow up, they face these troubles, and then they do not know how to come out from these things. So when these are the ignorant people, and also the age group of 15 to 25 years are the people who are most ignorant, I suppose, because they do not know what to do, but they are always curious about to do new things which come up with in this generation. So ma'am, is this the same way through which we can aware these people about
I believe I said now that right age of sex education is like 10 to 12 years. I know there are so many schools, there are so many teachers, there are so many students who are skipping the chapter of reproduction every now and then. I don't know why. What is the fear of it? You have to teach them, na? It is nothing. It's our own body physiology, on biology. We have to teach them. I think firstly we start with the basic thing. दो चीजें हैं, हम कहते हैं ना, we have two gurus. Parents are first teachers of us. So this education should be given from the parents side as well, I think. And उसके लिए हमें community awareness करना चाहिए. हमें parents को बताना चाहिए कि how important it is to tell our child कि what is important, how our body is functioning. So एक हमें community को target करना चाहिए. दूसरा, there is school education. As we said कि 15 to 25 are not being aware, क्योंकि जिस stage पे उन्हें ये चीजें समझानी चाहिए थी वो हम नहीं समझा रहे हैं. I feel like every school should celebrate the World AIDS Day on 1st December. उस time पे we should give them the activity. They should come up with the ideas. They should learn. मतलब एक होता है कि हम उन्हें पढ़ा दें, पढ़ाने से वो नहीं सीखेंगे. I believe उनको एक activity देना चाहिए to come up with themselves कि how they can prevent. They'll read it, they'll come. Internet has every facility. They'll read it and then come with the questions. I think AIDS Day हम लोगों को सेलिब्रेट करके उनको अवेयर करना चाहिए. दैट इज द वन थिंग आई बिलीव कि एड्स की अवेयरनेस इज वेरी मच रिक्वायर्ड, और वो हर स्कूल में इट शुड स्टार्ट लाइक 12 इयर्स के बाद. इट शुड बी स्टार्टेड इन एवरी स्कूल एंड एवरी कॉलेजेस. हमें उनको अवेयर करना चाहिए. Also, I would say that there is also a Doctors' Day we celebrate on 1st July. So I think they should, every school, I think school should take this initiative on their own behalf, or any NGOs should work with schools and let them help to create this week as a doctors week. And they can invite doctors, they can invite community health people, they can invite NGOs who will sensitize the children who doesn't know about it. There are so many teachers also. See, the secondary teachers might be knowing the sex education, they'll teach them the reproductive system, but they don't know the physiology and the pathophysiology of diseases, right? So they should more, इसे कहते हैं intersectoral collaboration should be there. School should work all together with us, with NGOs, with hospitals, with community. All together will work and make them sensitized. Tell them our younger generations. Younger generations हमारा target हमेशा होना चाहिए, because they will keep this legacy forward ना. उनको ये चीजें अगर हम आज नहीं बताएंगे तो ये स्टिग्मा इतना persistent हो जाएगा, this will very hard to break at that time. So मुझे ऐसा लगता है कि at that stage हमें एक इंटरसेक्टोरल कोलैबोरेशन को इनिशिएट करना चाहिए. सबको साथ मिलके इस चीज को सेंसिटाइज उन्हें बताना चाहिए, उनके साथ इस चीज के बारे में डिस्कस करना चाहिए. दैट्स द मेन थिंग. टॉक अबाउट इट. टॉकिंग अबाउट HIV इज मस्ट.
Ma'am, it's true that we are having sessions on HIV whenever it's a HIV day or something such important events. We are having sessions and it's really very informative. But the thing is that today's generation never come up. Like, to make it more interesting, what do you think that we can do? Shall we enact dramas to make them more curious about this thing? Because we have to make this thing more interesting so that they know
I said ना, I said don't teach
Yes, ma'am.
them. Teaching and learning का जमाना भी चला गया. Don't teach them कि ये slide है, this is the presentation. No, don't teach them. I said ना, perform some activities. We said नुक्कड़ नाटक कर सकते हैं. Give them tasks. Tell them कि if you know, give them the scenarios and let them come up with the ideas. We have to make them involved in this. We just give them the topic. This is the HIV, and you have to tell how you will protect this. What activities they have to perform the activity. Na, they'll think their own creative minds how they have to do it. Nukkad Natak are the very good thing that they are practicing. So many social workers also, community health workers are also focusing on this. Nukkad Natak is very prominent, very helpful in the community sectors, right? Community में अगर हम जा रहे हैं to make awareness, Nukkad Natak can be performed there also. So yes, that activities could be come up from the children's side. We should give them the task to come up with the activities. This should be the other way out. We'll not teach them; they'll teach us. We'll be the student on AIDS day and let them teach us what they know. They'll know. हमसे ज़्यादा वो पढ़ के आएंगे. I'll tell you. We should reverse that teaching standards, I guess.
Ma'am, so now coming to the myths, which you have already discussed in the session, and then there is another one myth that it is okay to have unprotected sex if one and his partner, they both are positive with HIV. So ma'am, is it true?
No, it's not. It's not. It's not. Then also they have to practice a safe sex practice, and I'll tell you why. I said you didn't ask me a question why HIV is non-curable. You didn't ask, right? I'll tell you why first. कि HIV non-curable क्यों नहीं है? Its name says virus. I'll tell you, virus has a tendency to change their structures every now and then. Alright? हमारे पास bacterial infection के लिए antibiotics है market में. Virus के लिए we have very few antiviral drugs, right? Because कभी भी हमें common cold होता है, जुकाम होता है, we don't get any viral. We said our doctors also said 3 दिन में ठीक हो जाएगा. Why there are no drugs for common cold? Because the virus keep on changing its structures every now and then. Alright? अगर virus change कर रहा है तो medicine will not affect ना. That is why HIV is we are saying it's non-curable, right? So यही मैं बात यहाँ पे बोलूंगी कि हमने ये बोला एक सेकेंड. हाँ, so what was the question? Sorry.
That it is okay to have unprotected sex if your partner
that is what I was saying, that HIV is changing its structure every now and then. So both the patients, both the HIV person, male and female, they might be having a different strain, and if they have unprotected sex, they may exchange that virus strain to the other, which may be a resistant to antiretroviral drug. So it's very important कि हो सकता है ना दोनों का वायरस स्ट्रेन अलग हो. So अगर एक से दूसरे में ट्रांसफर हो गया और that is resistant to their drug, so वापस से वो सेफ वो नहीं हुआ ना. Now they have to change their drugs. That's why it's required. Also, condoms are not only for the HIV transmissions. There are so many other sexually transmitted disease. हमें सिर्फ HIV से protect नहीं करना है. So there are other sexually transmitted disease. We have to protect them, protect ourselves from them. Also, there are hepatitis, gonorrhea, so many other diseases. So if you both are having HIV, doesn't mean you will not transmit any other disease. So safe practices, that is why also required. These two reasons we should practice safe sex practice.
Okay, ma'am. Then when you were talking about the stigmas again, ma'am, you said that mosquitoes are not the transmitters of HIV. So ma'am, they can be carriers, right? If one person is infected with HIV, then if the mosquito bites him, then the mosquito acts as a carrier. If it stings that person infected, and then he goes for the other person who is healthier, and that person can also get infected with the virus, right? Then how can mosquito be not a transmitter of HIV?
Mosquito cannot be a carrier for the HIV virus. It doesn't allow. The size of the virus is a very different. It cannot transmit. They cannot carry the virus through the blood, through the mosquito. It cannot be transmitted from one mosquito to the other. It's not that way. It doesn't happen that way.
Okay. Okay, ma'am. So these are some of the questions that I wanted to ask you. Then I'll also request the other participants as well to ask questions if they have. Then how is your personal experience on this? Like, have you ever faced someone suffering from this virus? And how?
Yeah, I have seen. See, I tell you, they are already, I said, the internalized stigma is so much encroached in their minds, and we have to, I tell you, that is why we are saying people living with HIV, they are the warriors. They are living with their own mental health. Mental health of HIV, people living with HIV is very mandatory because उनके दिमाग में अलग से चल रहा है. उनको पता है that society is not accepting. Simple सा I'll tell you, if anybody go through a breakup also ना, उनको बहुत एक ऐसा feel होता है कि अरे लाइफ में सब खत्म हो गया है, मेरे को nobody is asking me. That is a breakup person is feeling. Think about the people who is living with HIV. Whole society is thinking that, because see, I'll tell you one big thing also here. कि स्टिग्मा ये नहीं है कि people is having HIV. Stigma majority ये है because we judge them because of their sexual orientation. We judge them that they might be having multiple sex partners. I don't know how kind of a sex practices they are practicing. पता नहीं क्या कर रहे हैं. So this kind of a stigma is there. If anybody is being diagnosed, so उनको एक internalized stigma है कि society मुझे किस नजर से देख रही है, मुझे acceptance नहीं मिल रही है, मुझसे सब दूर भागेंगे if I tell them. तो मुझे ऐसा लगता है कि मैंने जितने पेशेंट्स देखे हैं, द काउंसलिंग दैट आई सेड ना, आई मेंशन इन एआरटी सेंटर, अ काउंसलर इज वेरी मस्ट बिकॉज उनको टाइम टू टाइम काउंसलिंग बहुत रिक्वायर्ड है. They are not only fighting with HIV, they are fighting with the stigma, they are fighting with the society, they are fighting with their own stigma which is being built up in their mind. So that is why we have to develop empathy for them. We have to, you know, उनको हमें, they are not other than us, they are just like us. We have to value them, we have to give them, you know, a supportive language, as I said. हमें उनकी वैल्यू कर, मतलब उनके साथ एक नॉर्मल बिहेव करना चाहिए. दैट इज व्हाट दे रिक्वायर्ड, आई गेस. दैट इज व्हाट आई हैव सीन. I have seen so many patients at ART centers and they are like shedding tears that we can't tell, and so many are being discarded from the society when they get to know that there are people living with HIV. They are living so far away from their society, far away from their families, because हम ये अवेयरनेस अभी तक पहुंचा नहीं पा रहे हैं हर घर तक कि छूने से नहीं फैलने वाली है बीमारी. They are your family members, you have to deal with them, you have to give care to them. This is the main motive, I guess, कि हम लोगों को बहुत जरूरत है. Counseling is not only for the patients, counseling is also for the family members. I'll tell you, there are so many patients, there are so many males which are diagnosed with the HIV. The counseling sessions are held like this. First we counsel the HIV men, then we counsel their wife, then we counsel their family members. And family members are being involved only if they allow us, because sometimes they want to maintain their privacy, they don't want to share it with their family also. So but the first thing that we counsel the person who is living with HIV, they are the partners, and then we counsel the family also for the same. It is this cycle we have to go through it. So counseling is very must. I have seen through this कि इसकी एक्सेप्टेंस अभी तक एक पर्सन नहीं ला पा रहा है, उसकी फैमिली को एक्सेप्टेंस दिलाने में बहुत टाइम लगता है. This was the experience I have seen कि हम डिजीज से तो somehow they'll fight, they'll live, but the mental health is very deteriorated with them now. That is much we have to focus about it.
So, ma'am, if there is no question from the other side, then I would like to conclude this session, ma'am. It was really very informative to know so many things about HIV. I was also ignorant at the same time because just I said about the mosquito thing, I have been believing this thing, no, that mosquito can be a carrier, and today I came to know that it is not. So when I also have so many stigmas regarding this, and so this session has been very much fruitful to me because I have got to know so many things again. So ma'am, I would like to thank you for bringing up this topic and actually breaking the silence. So ma'am, thank you so much for being a part of this session. We will also have some sessions again with you, ma'am, in the future.
Sure. Anytime. You can also connect with me on LinkedIn if anybody wants to ask any questions regarding the same. I would like happy to help answer the questions. So you can also connect with me there. And thank you for inviting me. I would love to share the information and breaking the myths.
Okay, ma'am.
Thank you so much for inviting. Thank you.
Thank you, ma'am.